And so the developmental course of eating disorders is that they rarely begin before puberty, usually right around puberty, because of the intense focus on self-image that begins around puberty and in adolescence. There's a great shift of thinking about peers, how I look compared to my peers, my image, and how my image compares to my peers, but also those who my peers and I are interested in TV and in media. There's often a precipitating stressful life event, which can be a humiliating experience or something that really focuses the child to focus on their own body and their own image. In anorexia nervosa, the physiological or body changes can exacerbate the symptoms. So the symptoms of losing weight, and then losing weight makes those symptoms even worse. In bulimia nervosa, developmentally, the binge episodes can be stress-inducing, and it can lead to more of a automatic kind of binging. So they're more binging, it becomes easier for them, and they become more binging to relieve stress, as we saw in the second vignette. So it's not just eating to relieve stress anymore, it's binging now to relieve stress. And there's a subset that cross over from anorexia nervosa to bulimia nervosa, or vice versa from bulimia nervosa to anorexia nervosa. And so there's a variable long-term course of what this looks like over time, but there's a tendency for patterns to persist and reoccur. Basically, these eating disorders can progress and start in puberty, and they get worse. There is some crossover, but treatment and therapy is usually ongoing, and eating patterns can return during childhood and young adulthood. Some of the causal factors are that temperament is related to anxious and obsessive traits, so that's more the restrictive type of eating, and poor impulse control is related to more binging and purging. We do know there's a genetic predisposition for that, but again, remember, genetics isn't everything, it's just one risk factor. Biologically, there's also some brain abnormalities and also evidence of early physical maturation that might be related to bulimia nervosa. And the physical consequences of eating disorders can be risks in themselves. So perfectionists who need to control their body is typically related to anorexia nervosa, where bulimia, they have poor self-control, but not all eating disorders are the same. What can parents do for eating disorders? First, there's prevention. So this is focusing on positive attitudes in childhood and behaviors regarding their own weight and appearance, so not always focusing on their weight, focusing on dieting, focusing on what they look like. And that can instill in children focusing on positive attitudes about how they look. We can also examine our behaviors and expectations that we are modeling and messages that we send, so what we watch as parents, what we are telling our children. Also, not shaming kids. First and foremost, not about image or weight, but also just not shaming kids, because that can lead to shame about body feelings and body images, as well as just providing good foods that are healthy and nutritious, and don't categorize foods as good or bad, but a continuum of foods that are good or less good. Sometimes foods, always foods. Also promoting activity and not avoiding activities, and so don't avoid to get ice cream just because it might be unhealthier food, but promoting good activities in conjunction with kind of sparingly using of sometimes foods, and this is increasingly important with more focus on screen time in kids earlier in life, as well as encouraging self-esteem and self-respect, and talking about images about weight and what the media presents and how that might not be realistic. In cases where there is an eating disorder, what parents can do is provide non-judgmental patience. So really not judging adolescents for having an eating disorder, because they can't help it. It's something that needs to be treated, but it's not something that can just be kind of cured overnight. Providing loving detachment, so that means providing positive support without avoiding negative reactions. So positive support without any negative reactions, respond and treat the eating disorder and provide acceptance of it, so don't deny it, avoid it, or be ashamed of it. Acknowledge that it's there, but differentiate the eating disorder from the child while also providing self-care for the parent. Another causal factor we know is psychological. We talked about psychological factors in anorexia nervosa. Might be different from bulimia nervosa, but it might be related to independence and seeking control over one's life. A denial of physical and psychological maturity can also be possible. But we know there's also distorted cognition specific to image and self. So seeing yourself as something in anorexia nervosa that you are not. So having a cognitively distorted view of what your body looks like, even though it looks like a different thing. And a preoccupation with body image, both in anorexia nervosa and bulimia nervosa. And those images being strongly tied to your feelings of self-worth. There's also relationship factors. So early studies blamed eating disorders all on families, but that's not found to be the case. In fact, there's found to be an important role of parental attitudes, modeling, and communication about eating and diets. So really just an importance of parents' attitudes and modeling about the importance of food and body image and what those look like. Some studies have found that abuse and maltreatment, again, those strong negative life events, can be tied to eating disorders. So relationship factors where they're severely negative can be related to that. And as we opened this section, we talked about how eating disorders can be kind of seen in these Western societies where socioculturally we really emphasize low body weight. And these Western cultures, particularly the U.S., thinness and being thin is highly valued, or for males being highly muscular. And there's a strong sex role socialization, so looking very thin, looking as like the perfect human being, which is unrealistic. And there's greater eating disorder in sports where body image is idealized, so in things like modeling, in weightlifters, in gymnastics, it's really high rate of eating disorders because of the social cultural pressures we put on body image. In the Western culture, eating disorders are 50 times more prevalent than in other cultures. And as we talked about, in women it's 10 times more likely than men because of that emphasis on body image. That's incorrect. So there also might be some evidence for gene-environment interplay, so where individuals might have some biological or genetic small predisposition, again, nothing that would really kind of lead to an eating disorder in itself, but these individuals experience a strong negative life event, that might trigger an eating disorder based on this underlying disposition that they have. So it might be that there is some gene-environment interplay at work here. As far as therapeutic interventions, Maudley's model of family therapy is shown to be the most effective. It's effective and it's widely used. It has intensive outpatient therapy in 3 phases, and families are essential in treating it. So basically, it's a family therapy that focuses on the family's role in helping those with eating disorders get treatment. CBT, or cognitive behavioral treatment, is also very effective. Cognitive behavioral therapy is where we kind of self-monitor our thoughts. When we find a negative thought or something, we challenge it. Why am I thinking this? Am I thinking this? Is that true? No, it's not true. And we change it to a positive thought, which then results in positive behavior. And it's more evidence that this is effective in older teens. Prevention is also very important in therapy. So parenting stressing realistic body images and realistic and healthy eating is also key. So just a quick review, anorexia, bulimia, and binge eating disorder all have complex origins, more than just wanting to be thin, but different etiologies as far as what they look like and their influences, a combination of both biological predisposition, strong negative life events, poor relationships, and precipitating factors and those roles of our social culture that might all collectively contribute to eating disorders. These are characterized differently by self-control behaviors, and we know there's a lot of risk factors, and therapeutics can help, but it's a long journey.